Hi there, Mike the Neuropathy Nurse back again. And if you live in the United States and you're dealing with the pain, the tingling, the numbness, the balance issues of peripheral neuropathy, well, you understand what the studies already say. Right, so this one here, you definitely understand. It says restoration of sensation, reduced pain, and improved balance with subjects with diabetic peripheral neuropathy. And one of the things that stands out is that a satisfactory pharmacological treatment option has yet to present itself. So, what I'm getting at is you already understand that the medications that you're taking are not working. You understand that despite following certain treatment plans designed to just kind of mask and cover up symptoms, this condition is continuing to progress. Well, that's because you're treating symptoms. You're not treating the root cause of why the symptoms exist. There are over 100 causes of peripheral neuropathy. That's diabetes, the most well known, cancer treatment, back injuries, trauma, statins for cholesterol. Inside the top 10 is something called idiopathic. And in idiopathic neuropathy, it just means that they don't know why you have it. You just have it, and then they're going to follow. When I say they, the traditional healthcare system follows pharmacological management, symptom control, surgeries, injections. But let's remember, a satisfactory pharmacological treatment option has yet to present itself. And that kind of piggybacks on this study about gabapentin, which states here there is no significant difference in pain relief between gabapentin and a placebo. So you can take gabapentin or you can take a sugar pill. No difference in results. You make the decision for yourself. But what is the root cause of peripheral neuropathy? Well, yes, it's diabetes, cancer treatment, idiopathic, and all those, but what they have most in common is, like it says in this study, cardiology and vascular research, the effects of light therapy on vascular functions in patients with peripheral neuropathy. It isn't due to impairment in blood flow, which leads to microvascular disturbance. Well, what is that disturbance? Well, if my hand is a nerve cell, and my palm of my hand is the body of the nerve, and my fingers are the little blood vessels, that microvascular disturbance is in those tiny little blood vessels supplying the nerves and tissues with oxygen, right? So if these are kinked off or disintegrating or shrinking up, well, that is a microvascular disturbance. And in 5 weeks, in this study that we were talking about, microvascular function increased significantly by 25% from baseline. And that was in, 5 weeks. 5 weeks. Okay. And then we have this study here, symptomatic reversal of peripheral neuropathy, where 100% of subjects had improved sensation. And in the very first paragraph, in part, it says impairment in blood flow that results in hypoxia of the nerves. Hypoxia is just a way of saying suffocation. So the reason that the pain, the tingling, and the numbness exist is, again, because those blood vessels are shrinking and shriveling up. Right? But it's correctable. Our bodies make new blood vessels every single day, or they're trying to. It's a process called angiogenesis. It's one of the main ways our body heals. We know that our body makes new blood vessels because if we get a cut or we have surgery, that blood flow comes back. So here is another one that speaks to improvement in sensory impairment in patients with peripheral neuropathy. All patients obtained improvement in sensory impairment. That means they got the ability to feel their feet. They can tell when something's hot, something's cold, sharp, pointy, and that overall affects balance. And if we do not improve these sensory impairments, this condition is progressive and irreversible. And when we say irreversible, if those nerve cells die and those tissue cells die, you can't get them back. And that this is caused by, again, microvascular disturbance. And, there's letters from the Cancer Treatment Centers of America where chemotherapy-induced neuropathy, 96% success rate, and the list goes on and on. So if you live in the United States and you're seeing me, or you see one of the social media posts saying, hey, Mike the Neuropathy Nurse, I'm doing webinars. I don't want anything from you. All I want to do is share information. And if I can connect you with a root cause healer in your area, I'm going to do that. But understand that growing new blood vessels is something our body does. There are doctors out there, again, I call them root cause healers, and they're across this country, not in large numbers, but they're there. And they've literally helped so many people regrow these blood vessels back naturally, without drugs, without surgeries, and without injections. So I encourage you, if you live in the United States, to reach out, leave a comment. We'll get in touch. If you see one of my ads, and they're not an ad to sell anything, they're just an ad to freely share information so that you can get the help that you need. Because continuing on the path of just masking symptoms, taking medications, surgeries, and these injections that do nothing to foster new blood vessel growth, things are only going to progress, and they do not necessarily have to. So again, I'm Mike the Neuropathy Nurse. I'm here to provide information. I'm a patient advocate and a patient educator, and I've spent 40 years of my life in service to patients. And I'm here to help you find the answers that you deserve so that you can get your quality of life back. All right, I hope to talk to you soon. Bye-bye.